One other thing I want to mention about my own personal story here is that my daughter, see, I was very, very unconscious at the time in terms of my awareness of the evil, the level of evil that we're dealing with. I said yes to them doing a tracheotomy on her. She died during their surgery, and I found out years later that they do surgery on infants without anesthesia. So it's amazing that any of the babies live through the unbelievable amounts of torture that they are experiencing in a neonatal intensive care unit, not the least of which is a total separation from an ability to receive loving human touch.
Yes.
And to bond with another human being, because they're on machines, and my baby had tubes everywhere. I couldn't even hold her, you know?
And you'd mentioned the massive increase in adrenaline or epinephrine when this unbelievable torture is occurring. It was quite amazing to me. You know, I've been studying all these things for years, and I have a medical dictionary that I just happened to be flipping through one day, and I came across the term adrenochrome. And what adrenochrome is oxidized epinephrine. And then I found out subsequently that these psychopaths that engage in Satanism, ritual sacrifice, and things of that nature, this is what they're looking for. That is the hormone, the oxidized epinephrine called adrenochrome, that they're gaining their energy from to do what they do.
People become addicted to adrenalized blood drinking. And in fact, most of the people that eat meat are addicted to adrenalized blood and flesh because they're eating animals that have been tortured and terrified right before death, which floods the system with these hormones that become addicted. So something we all want to consider are the satanic elements of what we're involved in our own lives that we may have never looked at in quite this way. But the fact is, it's really quite mainstream.
Yes.
Certainly the drinking, the consumption of adrenalized meat is very, very mainstream.
Yes.
And we want to pay attention to that. So we've got a little bit that I talked about the neonatal intensive care units. I want to compare, like in South Africa, what they're doing is called kangaroo mother care. So if a baby is born prematurely, it is instantly strapped to the mother's body, skin to skin, 24/7. It's with the mother or the father, skin to skin. The reason that they do this is so that the baby has the highest chance of possible survival and bonding, that its temperature will be regulated through its connection to another human body, and obviously the maximum potential for getting well and developing into a full human being, you know, a full-size human being, as opposed to what we're doing in the United States, isolating them in incubators and other things and preventing them from having human touch. This is quite deliberate. Bonding is not allowed to happen in the satanic families. Children are prevented from breastfeeding most of the time, prevented from making any real bond with their mother, especially. And this makes them much easier to train, to become psychopaths.
And this is why we're always led to believe, oh, those people in Africa, they're so, you know, behind the times. And we see more and more that the missionaries are bringing in Western technology and building hospitals for these people. And, of course, they think they're doing good. But what they're actually doing is the very opposite.
Let me stress that the mind control is so extensive that we've got the majority of the United States population believing that hospitals are the safest place to give birth. The mind control is extremely effective. In reality, American hospitals are some of the most dangerous places to give birth. And babies and mothers are dying in huge numbers in the United States precisely because they have entered hospitals to give birth. The United States now ranks 60th in the world, which means there are 59 other countries doing a better job than we are in terms of keeping mothers alive who are giving birth. I mean, we've got countries like Pakistan doing a better job than we are. Also, we're like 50th in terms of babies, the survival of babies, getting past the first day, which means 49 other countries are doing a better job than we are. We are one of only 8 countries where the infant and maternal mortality rates are going up, and more than 50% they have increased over just the last 5 years. So it's extremely dangerous to go into a hospital to give birth. You could end up dead. Your baby could end up dead. It's not a safe thing to do, no matter what. While you're in prenatal care, they're going to be doing bunches of ultrasound, right? At some point, they're probably going to say to the mother, your baby's too big, your fluid's too low. I'm forgetting other things that they might, other reasons that they might give. Oh, your placenta is aging. That's another really good one.
Right.
We have to induce you. They're going to make up a reason for this. Just know, people, if you let them induce you, you've got a 75% chance you're going to end up with a C-section, okay, having your baby literally cut out of your body. But the induction procedure itself is extremely, extremely violent. So once a mother says okay to this because she believes they're nonsense, she's in for a hell of a ride. Because, first of all, let me say, in a natural birth, the baby is in charge. The baby will signal the mother that it's ready to be born, and the mother's body will begin to produce the hormones of birth, and the birth process will proceed. But this is by the baby's direction. Okay, this is the baby's choice and the baby's knowing about when it's time. That is so important in a natural birth, and for the baby to be born feeling like it has control over its destiny. 1/3 of babies are denied this. 1/3 of babies are induced in the United States. 1/3 of babies have their birth imprints hijacked and stolen in an extremely violent way. So what they're going to do is they're going to use drugs. There's 2 main drugs that they're going to use in the United States to force your baby out of the womb prematurely, before your baby's fully developed, before your baby's ready, which means premature. The drugs are called Cytotec or misoprostol, however you pronounce it, and the other one is called Pitocin. Let me talk about them separately. Cytotec is an ulcer drug. It is being used in hospitals to do something called ripen the cervix, or to create a miscarriage, basically to have the baby fall out of the mother's body. It is a drug that is being used not only off-label, because it specifically says it should not be used on pregnant women. It is being used against the label. Every day in American hospitals, women are getting uterine ruptures, amniotic fluid embolisms, and they're dying. And they're dying in large numbers. Whenever you read a story about a mother who gives birth to a baby and within an hour or a couple of hours is dead, ask the question, was she given Cytotec? Because that is one of the major culprits of killing women and babies. If the uterus ruptures, what do you think is going to happen to your baby?
Mm-hmm.
Okay, Cytotec creates really intense contractions. The same thing that Pitocin does. Pitocin is a synthetic oxytocin. It's chemicals. It's poison. Now, natural oxytocin is the hormone of human love. It is the hormone of human bonding. It is the hormone of well-being. It is the hormone that allows for a mother and baby to bond. It is the hormone that allows for the birth to feel ecstatic, for the neurobiology of love to activate at birth. It is the hormone that allows for the letdown of colostrum so that a mother can feed her baby. Now, here is how insidious Pitocin is. When you give a laboring mother Pitocin, it tricks her body so that her body won't produce the real thing. And if the real thing is not happening, then human love is not happening, or will be severely, severely undermined. And not only that, but the production of breast milk. Okay, Pitocin is also very important for normal contractions. In a normal birth, in a natural birth that's unhindered by any form of technology, in a natural birth, a contraction will come. It's usually around a minute long. It'll peak for it'll build, it'll peak for like 20 seconds, then it'll level off, and then it'll stop, and the body will rest. This is nature's order, right? Another one will come, it'll build, it'll peak, it'll come down, the body will rest. There is no such thing with Pitocin contractions, because they are intended to create pain for the mother and the baby, and it's intense. The Pitocin contractions come one on top of another, so that there is no rest. And so that the uterus is turned into a trash compactor instead of a birth portal. And the mother is going to be sitting there going, oh my God, I can't take it. begging for an epidural, begging for some form of pain relief, because everything that's happening to her is not natural and creating immense pain. And I want to stress that if there's pain for the mother, it's worse for the baby, because these contractions are crushing your baby and they are causing fetal distress.